talk about the industrial action which has been declared by the allied professional health workers, the nurses, and midwives. Government takes note of this industrial action of the health workers, namely really the allied professional health workers, the nurses, and the midwives in the public service. This action commenced on Monday, the 16th May, 2022, and Thursday, 26th May, 2022. This action, much as taken place, is seriously in contravention of Section 8, subsection 3A and B of the Public Service Negotiating, Consultative, and Disputes Settlement Machinery Act of 2008. Among others, this act stipulates that the commencement of industrial action should follow a 90-day notice after exhaustion of all avenues of conciliation, arbitration, or dispute settlement with the employer, in this case, it's government. So the action is in contravention of that. In this regard, government is calling on all allied professional health workers, nurses and midwives to report to duty by Monday, the 30th of May, 2022, and failure to do so, all these workers will be considered as having abandoned duty and resigned accordingly. The chief administrative officers and hospital directors are hereby directed to take stock of all these cadres and declare the vacant positions in line with the laid down procedures. We wish to reiterate as government that the health workers have actually been engaged in various consultations which have included the executive, the president himself, the cabinet, the office of the prime minister, the permanent secretary, minister of health, the minister of finance, planning and economic development, the minister of gender, labor and social development, and of course, the Ministry of Public Service. We have had various engagements and with the unions at various times of this year. And the topic has been social enhancement. And also we recall that in 2019, there was some enhancement as well. And there's a point we have reached with regard to that aspect. So it is no longer what it was in 2017. It is a new stage now that we are at, plus other issues which they have been raising, like the schemes of work and so on. All these have been arrived at. And we are confidently stating that the issue of pay enhancement has been budgeted for in the financial year 2022-23. I also wish to add that there is a lot of goodwill in government and among all the other stakeholders for the enhancement of all these health workers. There's a lot of goodwill, and everybody agrees that indeed, given the work these people do, they deserve a pay enhancement. but pay enhancement in line with our pay targets, which we agreed on. The pay targets also we agreed on in the comprehensive bargaining agreement that was signed. So there is no antagonism, there is nothing at all. We are also cognizant of the fact that the health workers played a very, very commendable part during the COVID pandemic. Yes, they were there in the front line, and that's commendable, it's very good. That in part has also added to the very goodwill which everybody has for their pay enhancement. That's why there has been a budget item included of pay enhancement for all these health workers, right from the sweeper at a health center up to the topmost health official. There has been pay enhancement embedded in the next, the coming budget. And we have not just stopped there, even the schemes of work, those have started. The issues of disharmony and so on, all those have been looked into, with the view that yes, once we have moved to some point, and since we agreed that enhancement would be in phases, this phase, let's go up to that level. The next financial year, we go to the next level until we hit the targets, you see, and then we can look at other public sector or civil servants, and then go through the process again. So all this is based on the 2018 Pay Enhancement Plan, the collective bargaining agreement which was signed, and most important, available resources. So communication of the revised pay structures obviously will follow the statutory procedures through the issuance of the annual salary circular standing instruction, the public service, alongside the budget for the financial year 2022-2023. At the moment, the process is ongoing. It would be premature, really now, for us to begin publishing figures. But let's wait, and the period is not too long anyway. Then these figures will be out. But I can state with certainty, and the union leaders of these workers know it very well because we have engaged with them, that indeed the pay enhancement, according to the availability of funds, has been effected in the coming budget. Therefore, I am calling upon the nurses and midwives and allied health workers to return to work and serve our countrymen and countrywomen the way they have done so, even in very, very hard times, like the hard times of the COVID pandemic. Let them return to work. And we're saying, at least they should all have returned to work by Monday. Those, of course, who don't return to work, will be their choice. And it will mean that they have really given up service in the public health sector, and then other measures can be taken. Thank you very much.
As you are aware, the Ministry of Gender is not only gender, but it has the labor components. And under the labor components, we register and recognize the labor unions. And of course, the health workers, through their profession, have their labor unions, which is directly handled by public service under the relevant laws. But when a strike is due, the law also spells out the issue of essential services. And health is one of the essential services that under the law is not supposed to be interrupted the way interruption has been exercised by that particular union. The Minister of Public Service has already indicated to you the series of engagements that have been going on. But I only want to indicate that from our ministry we are receiving complaints from those who have chosen to work that they are being threatened by those who are striking. Today I was in Mulago and I found nurses who have voluntarily decided to continue to work, that their colleagues who are demonstrating are threatening them to abandon the work. And yet, under the law, industrial action should take into consideration essential services like health. There were very many people stranded with babies. I found people stranded with babies. They couldn't get medical services. So when you see a decision being taken by government, it means that we do not want to lose lives. And that when there are people who are able to work to provide the essential services, taking into consideration the economic situation brought by COVID-19 and others, that we have balanced everything. We have balanced everything, engagements have gone on, and therefore the balance is that we take this in a phased manner. And I want to appeal to the unions that please reconsider your views and go back to work before the Monday. There are many who are willing to go back to work. Allow them to work, do not threaten them, so that we look for a solution together. Because the principle of unions is that you engage, you negotiate collectively and agree. And since we have agreed, really the minister has articulated, we have agreed with you as a government. Be patient in consideration of all the circumstances. I know there are people, other unions that have written letters. For example, the teachers union, the arts teachers union, they have written to both of us, and they also want to go to strike. Also, teaching is an essential services. So we are appealing to all the workers that circumstances beyond our control is what is causing us not to increase salaries for everybody at a go. So I want to appeal to those who have not yet been considered in this phase, like the arts teachers and others, that please let us move together, continue to engage, and be able to achieve together in this very hard economic situation. I want to thank you.
Very much, Honorable
Minister.